Good morning, good afternoon, and good evening from wherever you may be joining us. And welcome to this webinar on ensuring inclusion of women and girls living in Sub-Saharan Africa in responses to the COVID-19 pandemic. This is a webinar that is brought to you by the Konrad-Adenauer-Stiftung, the Rule of Law program. Now, we all know that women and girls are a very important part of our society, but they do continue to remain invisible in all aspects of the functioning of our society. And further, the face of systemic discrimination in accessing very important services remains the face of women and girls. Humanitarian crises, including and not limited to health crises, tend to affect men and women differently. According to the WHO, women account for around 40% of the COVID-19 cases, and this ranges from 35% in some countries to over 55% in South Africa. However, this data does not necessarily mean that women are safe or invisible. Globally, women are known for bearing the burden of duty and care for the sick, and in Africa, 65% of the women who work in the health and social sector fall under the nursing department. Women's caretaking responsibilities have more consequences for women, particularly in pandemics, because it is they who do the majority of the care of the sick at home. They also make up the majority of traditional birth attendants, nurses, and the cleaners and laundry workers in hospitals, where there is a huge risk of exposure, particularly given that these kinds of workers do not get the same care, support, and protection as doctors, who are predominantly men. Women are doing the most and are at higher risk. Today, we're going to discuss how the COVID-19 pandemic is impacting Africa, the women and girls in Africa, and look at how we're going to look at how women and girls can be effective actors for change. And although they tend to experience the effects of the crisis in different and often negative ways, given that the COVID-19 pandemic is not gender blind, the responses to the pandemic should not be gender blind. We have an expert panel to help us in this discussion and this conversation, and to discuss some of the challenges that are being faced by women and girls, and propose interventions to mitigate those challenges. We also welcome your participation, viewers. You can put in your questions in the Q&A, or you can make your comments in the chat box below, and feel free to join the conversation. Today, we will be speaking with Judy Gitau, who is the regional coordinator for Africa for Equality Now. Previously, she consulted with Equality Now Africa office, specifically working on the domestication and implementation of African Union's instruments in Africa on the rights of women. She has previously worked as a technical advisor on transitional justice for the Justice Sector Development Project in post-conflict Somaliland, specializing in access to justice, justice for victims of sexual and gender-based violence. She has also worked as a program officer with the Kenyan section of the International Commission of Jurists, managing projects that promoted accountability through prosecution of international crimes in Kenya and the Eastern African region, specifically Rwanda, Burundi, Uganda, Tanzania, and Sudan. Some of her key achievements include being part of Equality Now core team in filing a lawsuit against the Sierra Leonean government at the ECOWAS Court of Justice for denying pregnant schoolgirls the right to education. Judy is also a published author in the field of transitional justice and international criminal law. She's an advocate of the High Court of Kenya and a member of the Chartered Institute of Arbitrators. Welcome, Judy. We also have, as part of our expert panel, Meskerem Geset, who is an international human rights expert, a UN Human Rights Council mandate holder, UN rapporteur in the Working Group on Discrimination Against Women and Girls. She has served in expert groups of the African Commission on Human Rights, Human and People's Rights, and as Deputy Executive Director of the prominent Pan-African Institute for Human Rights and Development in Africa, which is based in Banjul, Gambia. She leads prominent human rights and women rights institutions, incentives, in initiatives and research in Ethiopia, Africa-wide, and globally, and serves in local and international governing boards of human rights organizations. She has been active in Ethiopian CSO movement and is among the founders of the chair of the Lawyers for Human Rights and Timran. She leads, as well as the former leadership of the Ethiopian Women Lawyers Association. She has practiced law in Ethiopia as a High Court judge and an attorney at law, and has been commissioned as an expert by various UN institutions and international organizations. And as an associate scholar at several universities, Ms. Kerem has teaching and research experience at academic institutions in Africa, Australia, Europe, Canada, and the USA, and has published and lectured on several human rights issues. We are also going to be speaking with the Maureen Samuela Tresha, who is the National Director at Women and Law in Southern Africa. She's also the National Coordinator for 1 Billion Rising Zambia. She's a lecturer at the Zambia Institute of Advanced Legal Education and a commissioner at Small Claims Court. She is in the steering committee of the Solidarity of African Women's Rights, monitoring implementation of the Maputo Protocol, and through WLSA, a member of the Southern Africa Gender Protocol Alliance, monitoring implementation of the SADC Protocol on Gender and Development. She has worked in various positions and institutions focusing on protecting the rights of women and children. This has entailed litigation from them, sensitizing them on their rights, sensitizing the communities on the children and women's rights, and capacity building of the police, traditional leaders, civil society organizations, and some judiciary staff on GBV-related laws. She's a holder of a master's in business administration and postgraduate diploma in international business relations, postgraduate diploma in legislative drafting, and a bachelor's at law. Welcome to you all. Before we begin our conversation, I would like to welcome Ms. Cindy Salim, who is a program officer with Konrad-Adenauer Rule of Law program, to make some opening remarks. Over to you, Cindy.
Thank you, Daisy, and greetings from Konrad-Adenauer-Stiftung. I'm Cindy Salim, the Program Officer, Rule of Law Program for Sub-Saharan Africa, Anglophone countries. Thank you for joining us today. Let me start by passing warm regards from our new Program Director, Dr. Stephanie Rothenberger, who's not able to join us today due to other official commitments. So kindly receive her greetings. And in achieving the program's main objective of promoting the rule of law, this year we decided to host a webinar series focusing on the protection of human rights. We've successfully had discussions on access to justice, the right to health, the effect of COVID-19 on sexual gender-based violence, independence of the judiciary, and today we shall conclude this series by discussing how we can ensure the inclusion of women and girls living in Sub-Saharan Africa in the responses to the COVID-19 pandemic. It will be safe to say that by now all of us have been affected by COVID-19, be it directly or indirectly. The pandemic has had an impact on us and affected the way we conduct ourselves and how we conduct our daily activities, both in formal and informal. When the pandemic was declared, people thought that it was something that would affect all of us in the same way, in that no one was unsusceptible to it. However, trends and experiences in the past months have shown that this is not the case. And as our moderator has mentioned, crises tend to affect men and women differently. What is happening currently shows us that we ought to differentiate those who are infected and those who are affected. Although the rate of COVID-19 infection in men continues to outnumber those in women, women continue to be more impacted by the virus. What the pandemic has done is deepen the pre-existing inequalities, exposing vulnerabilities in the social, political, and economic systems. Before the pandemic, governments in Sub-Saharan Africa had started taking action towards the elimination of discrimination against women and girls in both public and private spheres in the road towards achieving gender equality. However, government responses to COVID-19 are currently excavating the existing problem of discrimination and inequality. The introduction of lockdown and cessation of movement has impacted women, especially pregnant women, due to the challenge it has brought of accessing health facilities. An increase in sexual gender-based violence during this period has been recorded. Informal businesses, which are mostly occupied by women, have been affected, and closure of schools has led to the increase in adolescent pregnancies, early marriages, and female genital mutilation practices. These impacts will have a huge setback for the gains achieved over the years, where we had started seeing a reduction in the number of child mortality. The number of girls going to school had increased, which in turn had led to decrease in adolescent pregnancies and early marriages. However, different trends being witnessed during this period are worrisome, and there are now fears that the region might go back to where it was before the pandemic. We've seen previous research has shown that girls who experience a disruption in schooling are less likely to re-enroll than boys, and failure to get an education is one of the major drivers of gender inequality, which in itself is a major cause and results in hunger and poverty. Hence, there's the need to ensure that there's gender inclusion in all measures and laws being passed to make sure that the problem is not compounded. So in the next 2 hours, with the help of our panelists, we shall identify some of the lessons that we have learned from the effects of COVID-19 on women and girls, and see how best we can ensure that they are included under universal health in the Sustainable Development Goals. We shall also find out the importance of conducting sex-segregated data on the impact of COVID-19 in all sectors, that is political, social, and economic, and how this can help inform future policy responses. We shall also look at the role of governments and governing bodies in eliminating gender-blind policies and how they can design gender-sensitive protection programs. So on behalf of CAS Rule of Law Program for Sub-Saharan Africa, Anglophone countries, I want to thank the panelists, Ms. Judy Gitau, Ms. Meskerem Geset, and Ms. Maureen Tresha for their willingness to take part in this important webinar. I do not doubt that by the end of this webinar, we will be more enlightened on how best we can ensure that women and girls are not left behind in the responses to the COVID-19 pandemic. I'll now hand it over to our session moderator, Ms. Daisy Amdan, who is also a women's rights specialist and activist, to take it up from here and lead the session. Once again, I welcome you all, and I look forward to having a productive session. Feel free to engage with us during the webinar and also post-webinar. Thank you.
Thank you. Thank you so much, Cindy, and welcome once again to all of you. To start us off, my first question really goes to Ms. Meskerem Geset. We know that the COVID-19 pandemic is not, but we have seen that the responses have not taken into consideration the gender aspects. So what is the role of governments and governing bodies in eliminating gender-blind policies and designing gender-sensitive social protection programs?
Thank you very much, Daisy. Good morning to you all. I also thank CAS for organizing this important discussion forum on very important topic that is really deep to all our hearts as women, as human rights workers, and as part of the humanity. Well, maybe it's a very good question to really be addressed on how to tackle gender-blind policies. From what we have seen is the lack of gender-specific measures to address the pandemic. And let me start by emphasizing why in the first place we need gender-sensitive or gender-responsive policies. Or what the problem is with gender-blind policies in the first place from a human rights perspective. I mean, it's clear that gender-blind policies amount to gender-based discrimination, especially coming from my mandate that we work on the elimination of discrimination against women and girls. I mean, we assert that gender-blind policies amount to gender-based discrimination. Why? Because we cannot pretend that pre-existing gender inequalities and systemic discrimination against women and girls are no longer with us. They still exist. Inequalities are very prevalent in our continent and also globally. And so these inequalities need to be addressed through a gender-specific measures in the context of COVID and even without COVID. So it's already an underlying principle in international human rights law that the absence of gender-specific measures amount to discrimination because we cannot really address inequalities through this approach. And actually the CEDAW committee, the Committee on Economic, Social and Cultural Rights have long established that non-discrimination or elimination of discrimination is not an identical treatment of women and men. It rather reinforces discrimination, and to remedy pre-existing inequalities and achieve gender equality, it's not enough to guarantee identical treatment of men and women. Because gender-blind laws, policies, and measures do not really guarantee equality under human rights law. And the realization of human rights actually requires designing gender-sensitive policies to respond to the specific needs and experiences of women and men. So based on this foundation, even when we come to the context of COVID, as it was already reiterated that the way the pandemic affects women is different from men. It's not about, I mean, numbers or the majority of women being in the infected category or not. The way it affects women is different from men. And this requires specific attention. They have different vulnerabilities and violations that they are facing under the context. Of course, clearly it's based on their sex, but also overlapping with their different identity, like their age, their disability, or different ability, health and social status, economic status, geographic location, rural, urban situation, maybe their migrant status or their ethnic or linguistic origin. I mean, we can think of several aspects that really show us the intersectional element or the multiple forms of discrimination or violation that they can face. So it starts from the proper analysis and understanding and recognition of the differentiated impact of COVID or any other crisis situation on women and men. So it starts from this, the conviction on the importance of equality being looked at from the point of addressing the different needs, vulnerabilities, or experiences of women and men, which means actually equality under international human rights law. So this is an obligation for states, for governments, and other governing bodies when they aim to really address the human rights of all women and men. So from the COVID experience, we have already seen that women have particular risk and exposure based on their sex and other overlapping identities. And we have seen the burden, the economic burden and social burden have increased on women. And also we have seen that discrimination and violence in its different forms has really increased in the context of the pandemic, and also the participation of women has been limited. The space for their participation has shrunk in the context. So, I mean, we can unpack a few of the areas that need specific attention by government and governing bodies when they think of social protection systems or policies to respond to the COVID situation. So from identifying the really disproportionate impact, for example, we have seen the disproportionate burden of unpaid care and domestic work on women. I mean, this has already been there globally. Women and girls take more than, I mean, data shows that 3/4 of unpaid care. And this is even worse in rural and low-income countries like in Sub-Saharan Africa, where women spend almost 14 hours a day in care work. This has been already a pre-existing burden or inequality, and with the context of COVID, this has been significantly increased actually, due to the crisis, due to the closure of schools and care facilities and all that, and that we already know. So any social protection policy which aims to be gender sensitive should start from recognizing this fact, and also it should aim to reduce and redistribute this unpaid care and domestic work. Of course, again, women are different, as we said. We have rural and urban women, we have working women, and all those also engaging in the informal sector. So we have to really break it down to the different background and identities or experiences of women when we talk about even this. Even the economic burden, we know that in Africa, most women are overrepresented in, I mean, women are generally overrepresented in the informal and poorly paid work with lack of adequate social protection. This has already been there. And now with COVID, the disruption of this informal sector has really left many women jobless, or it has affected their livelihood. Many women who are in the domestic work, in agricultural work, also informal traders who really trade on the street or within community networks, and also sex workers. So all this, the informal sector has been affected by COVID. So when we think of gender responsive economic solution that really focuses on the workforce, we have to think about the informal sector, where women are really overrepresented, and this really needs a gender sensitive or gender transformative approach. And also with this, I think with labor and work, the forced labor trafficking, exploitation has really increased, where the justice system and other monetary mechanisms were not really functioning effectively during COVID. So there is also this part of the monitoring and accountability aspect while we parallelly work on the social protection system. So governments need really to focus on this aspect. I mean, we can think of also education and health sectors where women and girls have been affected differently. With school closures, we have heard more than, 700 million girls were out of school. This is a global figure, and it might have even increased by now. But we can imagine also how big the number can be in Africa. So from this figure, the significant share is in developing countries, like in Africa, where there are no much alternative schooling available. And this has really a long-term effect on girls' education outcomes. We already know that there is already inequality when it comes to education outcomes between girls and boys in the African context. So any social protection policy also needs to look at this factor. There is on one hand addressing the already existing the already existing inequality, and on the other hand, now the exacerbates the situation in the context of COVID, which requires special measure, for example. In many countries, maybe there might be temporary special measures being applied in the education sector to encourage girls to be part of the education system, or to empower girls within the education system. So now, since we're in a unique context, we need other special measures that are temporary also in the COVID and post-COVID response. And the health sector also, my last on this one. I mean, we can go on and talking about the areas of focus in the social protection system, but in the interest of time, let me just highlight the health aspect. I mean, again, yes, women have also different experiences as being infected as well as the affected group in the context of COVID. We have seen, for example, health services that are essential to women and girls being suspended or limited as non-essential, because all the shift has been to really addressing COVID infections, and the health system has been crowded. And we can imagine what that means in the African context, where we already have a very poor or weak health system in many parts. And in this sense, the specific needs of women and girls for sexual and reproductive health care and services have been really affected. We can think of access to contraceptives, access to services related to pregnancy and birth, and all that has been really affected. And there has been a backlash against sexual and reproductive health. So our gender responsive social protection system for COVID and post-COVID era should really take note of this specific aspect of the sexual and reproductive health need women and girls that has already that has been already an area of discrimination and violence, and has been again affected by the pandemic. So a proper analysis of all these aspects, the care and domestic work, the economic burden, the education aspect, the health, and I mean, there are also other aspects that I didn't really talk about, housing and food, all that has to come into the picture, and it has to be analyzed with a gender lens. So it starts from recognizing the different needs of women and girls, and also the different impact of the pandemic itself. Once governments and government bodies have done that, then we need to have a proper gender sensitive review of laws and policies and systems, institutions, and the integration of women's need in all actually social protection systems. Then with that, also the participation of women and girls should be at the center in all this. Women are not just victims. I mean, the narrative that women are victims and then we need to protect them, we need to do something for them, that narrative has to change. Women are, of course, they have their own different vulnerabilities, but they are also agents. They also have the right to participate in what really matters to them and to the society. So we have to bring the participation of women with creating enabling environment for their organizing and voicing. And then, of course, the budget aspect comes with this gender responsive budgeting to really make social protection systems work in line with the specific needs of women and girls. So the investing on this aspect or the gender budgeting should also be part of this approach. Thank you very much.
Yes, thank you so much, Meskerem. I think you've really given a bird's eye view of the many challenges that women and girls are facing, and what governments need to take into consideration to ensure more gender responsive policies and interventions, particularly in the pandemic. And we will revisit some of the issues that you touched on as we continue with this conversation. But I like that what you're saying is that we mustn't see women and girls only as victims, but we must also see them as being able to participate in alleviating some of the challenges that are being faced, not just by them, but by communities. As we continue this conversation, Judy, I want to bring you in. I want to bring you into this conversation. Now, we've heard it often said that data is king. And increasingly, we are seeing more and more data being relied on to be able to devise and interventions. But how can data mitigate the impact of COVID on women and girls and help inform policy responses by ensuring also the well-being for women and girls, not just within the pandemic, but post-pandemic?
Thanks so much, Daisy. Data is king. The truth of the matter is that the COVID pandemic has exacerbated pre-existing inequalities in structure and in the system for women and girls. And so the issues that we are raising, women have been raising for many years, bearing in mind this is the year we're marking 25 years since the Beijing commitments were made. And so if we look at maybe 4 key issues that have been a problem during this pandemic period. Maybe if I can hone on GBV, and when I talk about GBV, I'm talking sexual violence, intimate partner violence, harmful practices, FGM, and so on. I can hone on inequalities, and Meskerem has done a splendid job in just laying that out, everything from unpaid care work, all the way to inequalities in the economy. We're talking about increased risks for healthcare workers, which you talked about, and we're also talking about limited access to sexual and reproductive health and rights. And we've been talking about these things for years. And now with COVID, it has provided a moment for data to be collected in real time to show that women were not simply, making noise about making noise. And so we have immediately found data. And if you'll allow me to illustrate with some of our own examples, when, for example, in Kenya, we had our first COVID case in March. By the end of March, for example, as an institution, as the institution that I work for, which is Equality now, we were alerted of a risk of about 75 girls being at immediate risk in Samburu region within Kenya, being at immediate risk of being cut, that is female genital mutilation. And for those of you who are familiar with harmful practices, they will know that it's a continuum, and that once these girls would be cut, the next step would be these girls would be married off as children. And then we have work ongoing in Tanzania, for example, and within a certain week, we had 10 girls married off, some at the age of 10. And similarly, we have work in Sierra Leone, and so we had data proving that sexual exploitation was immediately ongoing at the back of movement restriction, social distancing, and restriction of movement as we know it. And so some of these issues that we've been working on for years, now marking 25 years with regards to legal commitments given at Beijing, data has enabled the discourse to move to the next step. And so, as with all disasters, the silver lining in this is that we've been able to progress the conversation. And so to link this with what it is you're asking, Daisy, is how do we then use this data to ensure policy change, to inform policy change, but at the same time to ensure that whatever we put in place, the measures that are put in place are long lasting or have longevity to ensure that we don't claw back on the protections that exist for women. And the way to do this, I dare say, is threefold. So first, advocacy must always be must always walk hand in hand with data. And so when we talk about data, we talk about both qualitative and quantitative data. In some instances, as I've talked about, we'll talk about numbers, huge numbers, trends, and so on. And when we talk about those, they then inform the big picture. But when we talk about qualitative, is when we bring the survivor or the victim's voice to the table. And so that when we're designing and informing the policy and when informing the legislative reform, then we make it with the user or the person who's wearing the shoe in mind. And so Data then informs the development of law. So it advocates for the development of law, but it also informs the development of law. With regards to advocacy, I would immediately speak again of the Kenyan experience and a report by about 10 or so civil society groupings that referred to gender-based violence or sexual violence more specifically as being a pandemic within the pandemic, forced the state to acknowledge that sexual violence was a problem hand in hand with COVID-19. And so when COVID hit us as a country, for example, the focus was on healthcare workers. The focus was also on the economic burden because there was, as with most countries, there was restriction in movement, but there was hardly any focus on the impact it was having on women. And what was going on behind the scenes, as you all know, was increased sexual violence, increased intimate partner violence, increased sexual exploitation. Statistics data in this regard forced the state to not only acknowledge that GBV was a pandemic within a pandemic, which was an advocacy win, but to also then, if the state made a recommendation that the National Center for Crime Research to undertake substantive research to have state-driven data to inform policy change, including the expediting of cases, GBV cases and sexual violence cases within the courts. And so this is just a quick illustration of how data then informs advocacy, making it more tangible, making it something that actors can grasp onto, and reducing the emotive nature sometimes that people attach to women's rights and think that it doesn't have substance, it doesn't have substratum, and so data moves it there. And then to my second point about informing the methodology or the manner in which the laws are developed, the response or the data that was put out indicated in the Kenyan context, and I will quickly illustrate with other countries too, that we didn't have a state-driven shelter. And so whilst administrative shelters, safe shelters for victims of GBV are something that must be underpinned in policy if funding is to be founded for them. And so we do not, at that point, we didn't have any state run or governed shelters. And so again, data resulted in there now being established a first state governed shelter, albeit at the county level, and other counties within the government beginning to move in that direction in terms of establishment of shelters for victims of GBV. Similarly, with our work in Sierra Leone, a push towards protecting girls from sexual exploitation resulted in a state response to increase protective measures by putting in place policies, especially for girls who would be found within the communities, but especially for girls who are being provided for shelter by the state. Because what would happen is that they had shelters, but within the shelters, there was sexual exploitation. And so are beginning to review existing government documentation because of existence of data. And in that instance, it was qualitative and not necessarily quantitative. So we didn't have a large number of women or girls being violated, but we had narratives of specific women and girls, which were then amplified to state actors, resulting in a positive response in terms of development of specific policy, which resulted in implementation of the same. I think the last bit to make on my part before maybe handing it back to you, Daisy, is that when you have data, it provides agency to the messaging that we've been again saying over the years. Again, having said the same things, have we not talked about GBV for years on end? And so again, this crisis has provided a pivotal moment, a seminal moment for us as women to show, using facts, using data, using statistics, the various ways, the intersectionalities of violations that are visited on women, which are only but exacerbated in the context of COVID or of any given pandemic for that matter. And so creating an agency for the state and the state actors to finish that last mile with regards to implementation. And so usually for many countries, there is an existence of legal framework, and if not national, then regional, because for example, many countries are party to the Maputo Protocol, many countries are parties to CEDAW. And so these measures and special programs and measures are already existent in the raft of instruments and documentation that we are party to. the missing link usually is implementation. And so this provides an opportune moment. It creates the necessary urgency for us to then create a template or provide a framework or a roadmap to show this is how we implement. And so we need to move forward and use the urgency of this moment to push the agenda forward to ensure the missing link in all our different jurisdictions are addressed. So for me, it will be those three things. Thanks, Daisy.
Thank you so much. Thank you for, I especially like your comment that what the data does, it moves us away from the emotional response, because women have been talking about this for so many years. And the response has always been, hey, you know, the women are just, you know, being emotional and overreacting. But it is true that data now provides us with the facts and figures that can show the urgency of the problem. The question then is, will the governments move? But at least we have the facts and figures for the advocacy to push in a very urgent way the issues around women and girls and the response to the pandemic. Moving on to you, Maureen, I would like you to tell us what lessons can we learn or have we learned from the effects of COVID-19 on women and girls, and how can we ensure that their inclusion under the universal, how can we ensure the inclusion under the universal health in the sustainable development goals? I think because I think we're all agreed that the effects of the pandemic have moved very many nations backwards. So what are we going to do in terms of being able to move the issues forward and ensure women and girls inclusion under the universal healthcare in the sustainable development goals? Maureen, over to you.
Indeed, a number of lessons have been learned from the effects of COVID. Just from what transpired, we saw a number of girls being quarantined in abusive environments. We also saw a lack of access to sexual and reproductive health rights. What happened actually in Zambia is that, if I can refer to Zambia, is that the schools were closed, and we didn't have people being fully quarantined, because it was just partial closure. So we could see a number of children just moving around. One of the things that is we learned is that what is most cardinal is comprehensive sexuality education to the children, both in schools and out. That is required. There's a need for access and increase of allocation of monies to the Ministry of Health, because we still found that even for those who were probably able to access sexual and reproductive health, they were unable to find what they could have preferred. So that is one of the problems that was found. And it also, one thing also learned is that there's need also for these services to get closer to the people. Clearly where issues of health is affected, where there's a weak health system, there's an effect even in attaining other sustainable development goals. So just to stress, the closeness of those facilities is important. So this is not only to health, but also if things like the police need to be closer to the people. We also need, so that there's importance of removing all barriers to health. There's need to improve affordability, accessibility, and quality of health care, just to ensure that adolescents and children are taken care of. And one of them being distance that I talked about. There's need to ensure that we have these services nearby. We have so many instances where people have to cover a distance of over 40 kilometers just to get to a health service. So that has a lot of negative effects, even worse in the COVID time because one, someone is already scared of going to a place where they're likely to be exposed. So if it's nearby, then the better. Affordability also, because it's not everything that somebody may be able to afford. So if we just ensure that the things that the children need to access are within their reach and they are actually accessible. So those are some of the basic things that that come up. They need for funding. They need for children to access. Budget tracking is also something that is very important. They are going to allocate to a particular method, and it's also within the 30% that they say they are going to allocate to health. So issues of budget tracking should be done now, because we know that when there's not enough money that is allocated to the Ministry of Health, then a lot would suffer. The women would suffer, the children would suffer, and indeed everybody else. So the budget tracking is one of the cardinal issues that we have learned we should do religiously, to ensure that in case there's anything that comes up as did COVID-19, then the impact would not be as bad as it was in the period that we are just exiting. I think for now, in summary, I'll rest there. If there'll be questions, then I'll be able to take them and give more information.
Thank you so much, Maureen. And I thank you for even raising the issue of affordability of healthcare, because I think this has been very problematic, particularly for African countries. And we find that including our very own Kenya, where the government has essentially told the people that they are on their own. We've seen insurance companies abandon patients really during the pandemic. And I think that this is also a major issue when we talk about universal health care. And then the contradiction that we are now seeing with governments literally abandoning people and the cost of care within the pandemic. So I think that is something that we are going to have to see how to do advocacy around that. Coming back to you, Judy, you talk about data, and I would want you to tell us about how is it that we would bring in the issue of data in being able to quantify this, the burden of unpaid care. Messeret actually mentioned unpaid care, the burden of care, and it's usually called the invisible economy. And yet we know that it is quantifiable, but many governments, in fact, I don't think that there is any government that actually quantifies it. How then what kind of measures would be needed to build gender inclusive economic responses, taking into consideration the burden of care, the unpaid care burden on women and girls, and how would data play a role in being able to actually quantify it so that it can actually be recognized as a contributing factor to the economy?
Well, Daisy, you know what? COVID has revealed the crisis in care work. So there's always been, as you've just rightfully described, there's always been a crisis with regards to unpaid care work. And this is both the work that women give in terms of the informal space, in the home space, but also to some extent recognizing the work that women are giving in healthcare. As you had aptly explained, when somebody is ill in the family, it's the family members that then do take care of them. Indeed, it's about, the global statistics speak about 75% of the work being taken by women in this particular space. But you see, it's until quite recently that there's been, collection of data with regards to that, with regards to unpaid care work. Until quite recently, data has been collected in this regard. However, very much like other crises that have been emerging within the context of COVID. I think it's in this period that we've begun to properly realize the pressure of unpaid work. So first, with the closure of schools, and so children are home, and therefore you can actively see, physically see, that which women have already known for the past million years, that this is work, taking care of children in the home context, taking care of the home context. We're now having, shall we say, other actors who traditionally wouldn't be in the home front, being in the home front, and being able to visibly see what this is. And so very much like what I'd illustrated earlier, which is both qualitative and quantitative in nature, to have specific data and to use this particular data first to quantify and then to monetize what this unpaid care work is in order to inform policy, which would put in place not just social protection, but compensation with regards to unpaid care work is critical. We know, for example, in most of our contexts that whenever we talk money, and especially money with regards to women, I mean, again, and I'm afraid I'm going to refer to Kenya severally, for example, with regards to a push in Parliament to have a 2/3 gender rule, the pushback was it would be too expensive to pay women members of Parliament. So similarly, pushing or advocating for monetization and social protections with regards to unpaid care work will come back with a pushback with regards to what are the financial implications, and therefore critical for data to be able to respond to that. But above that, I think the underpinning issue that needs to be addressed with regards to unpaid care work is that of social norms. It's a much, much longer journey, but one that must be addressed nonetheless. You see, unpaid care work is driven by our norms and our interpretation of gender equality or inequality, as the case is. I won't say as the case may be, but as the case is. And so without addressing these underlying issues, then we will completely fail whilst we're putting in place policy, which policies have been informed indeed by data, or seeking the implementation of policy, which policy has been informed by data. And so the data that we find should enable us to develop tools, methodologies, and strategies to actually address the underlying issues, which are the social norms that we need to address. Again, silver lining. The COVID period has painted this picture clearly. I don't know of any home context or traditional context that hasn't seen what it means now to take care of the family. I don't know of any home, wherever it is they are in the social ladder. And so it paints an excellent picture and gives, data sometimes presents as elitist. But when I talk qualitative, I'm talking the practical day-to-day. And so we've been able to illustrate that data in different home contexts, and people have been able to understand what it takes to provide this care for those who are in need in the family, for those who are unwell in the family, for the minors in the family, for the food, just for the basic care that takes place in the home context. We've been able to paint that picture and therefore have begun making a case. But we will lose a golden opportunity if we do not advocate for the changing of norms at the same time as we advocate for the putting in place of policies, which policies' primary position or primary reasoning would be, one, the social protections for women, but two, and fundamentally, but the monetizing of what this unpaid care is. And so these three strands have to go hand in hand, Daisy.
Thank you so much. And I agree with you. I couldn't agree more. And I think this is something that we mustn't lose this golden opportunity. I like what you say, that COVID has exposed to us the reality of that unpaid care work. But I think one of the things that COVID has also done is expose the hypocrisy of the world in terms of people working from home. For the longest time, it was so difficult for women to work from home because it wasn't considered work. And now everybody's working from home and it's considered work. So the hypocrisy of the system in terms of its discrimination and exclusion of women has really come out strongly. And I agree with you. As women and as advocates for gender equality, we must not lose this golden opportunity to address the norms and to find a way to to equalize the situation, because I think the men will understand it more now, seeing as they have had to live with the reality of having to work from home, having your family, your children in the house, homeschooling and all that. Over to you, Meseret. Sorry, yes, you wanted to say something, Judy?
I was just saying, Daisy, yeah, indeed, it's just to reiterate what you're saying and to say that it's either an opportunity to re-entrench the old, that will, after this, we go back to the norm, re-entrench the old, because what you'd find is that if the man is working from home, then the woman will still be taking care of the kids and everything else and allowing him to continue working. Because remember, structural inequalities mean the man perhaps was the one who would go out to work. And so he'd want to continue working from home as you sort that out. And so this could either re-entrench what already exists, or it could be an opportunity to revolutionize what is ongoing. So it's a double-edged sword, and we need to be aware of the danger as well as the opportunity.
We must take that opportunity. Thank you for that. And coming to you, Meseret, one of the things that having the family, both men and women at home, it has also brought out a monstrous realization about the safety of women and girls, and brought to us what is being called this shadow pandemic. Now, we've talked about it. I think everybody has mentioned, each one of you has mentioned the high levels of domestic violence and gender-based violence. Meskerem, you operate at a global level, and where many international and national leaders operate. With this shadow pandemic, we have not seen governments really come out strongly to address this major challenge, or even to make themselves the face of advocacy for or against domestic and gender-based violence, and put in place very, very strong measures to address it. Now, how do we address this challenge? Because the face of leadership globally is male. And I think that it would move us forward if our leaders would actually come out very strongly around this shadow pandemic that we're seeing. But we're not seeing that. So how do we maneuver around this situation and get them to be the voice for the protection of women and girls in the home and against gender-based violence, including sexual violence against women and girls?
Thank you, Daisy. It's a very interesting question. I mean, it's actually the challenge that we see at the global and regional level. I mean, the extent of gender-based violence, how it has also exacerbated as a pandemic itself within a pandemic has been well said by Judy earlier. I just wanted to add first, before coming to your question, also the challenge that we have seen is the invisibility of some forms of gender-based violence. For example, the economic aspect. As the economic violence has not been really articulated by so many or visibilizing by so many actors, but that's also one of the areas that we have seen specific vulnerability of women and girls in this context. Most of the discourse has been on physical and sexual violence, even in the domestic context, while we have seen widespread violence and conflict, for example, in Africa, exposing women and girls to further sexual, physical, and political violence, and also communal violence in the form of property grabbing, evictions that even lead to displacement, all that. So, I mean, a new, it's not new, I wouldn't say new, but a more a broader understanding of the gender-based violence pandemic itself is very important from what we have seen, and that is really missing in the context of COVID, because of course we have seen a lot of domestic violence, sexual violence, and all that. So and the other is, of course, in as much as there is really a lot of talk about responding to the COVID situation, and to some extent also discourse around how we can think of addressing the specific needs of girls and women. As you have rightly said, not many political figures really came out to advocate for the elimination of gender-based violence, or the recognition of gender-based violence itself as a challenge in this unique context. And I mean, we receive a lot of complaints from several countries, from different actors, calling upon our intervention to really engage with governments on this issue. But it's not really one of the priority agenda for many, that we have seen. So maybe one way is, of course, to really push for this new normative thinking on how really to realize the rights of women. For us, we put it in a package under the human rights obligation of states. I mean, as a human rights mechanisms, that's what we can do, and we really push for the human rights-based approach to all this. It's a matter of human rights, and we really need to advance the normative thinking of realizing the rights of women, and in this case, gender-based violence being really the most challenging aspect in terms of the violation of women's rights to bodily integrity, to sexual integrity and economic independence, and all that. And with this, of course, the data that Judy has been talking about earlier is very, very important. I mean, evidence-based advocacy is important to push really governments to respond to the situation. So data really plays a key role in terms of pushing. I mean, well, as a human rights mechanism, it's very hard to say this, because we are expected to engage in a very constructive dialogue with states, but in terms of really pushing states or governments, sometimes the naming and shaming approach also helps, so that states would bring where states would give attention to the attention that the topic or the issue deserves. And within this, of course, maybe working with also champions is very important. Sometimes we do that. Some states or political leaders key allies in terms of influencing and mobilizing their peers. So we work with champions, political leaders on a regional and global level. So in African context, maybe we need to pick our few champions who can really influence other governing bodies. Then that could really help. Yeah, thank you.
Thank you, Messeret. Yes, I like that. We should pick our champions. So I think we should start looking for which leaders can be our champions on this. Immediately coming to mind is somebody like maybe Paul Kagame. He's considered a champion for women's advocacy. I mean, women's inclusion. And I also like that the expansion for what constitutes gender-based violence, including the communal violence in the forms of dispossession and economic violence against women. And I think that this is also something that we need to start talking about. I like that. Thank you so much, Ms. Kerem. Over to you, Maureen. And I would want us to talk about the challenge that we have with the pregnant girls. Now, Ms. Kerem gave us a global figure of 700 million girls estimated to be out of school. And an analysis done by UNFPA and partners published on the 27th of April this year estimated that about 2 million additional cases of FGM, female genital mutilation or female genital cutting, could take place over the next decade that would have been avoided due to the disruptions of the COVID pandemic. Similarly, the analysis estimates that there will be more child marriages during the next 10 years, with families more likely to marry off their daughters due to the economic stress to alleviate the perceived burden of having to care for them. What mitigation measures must be put in place to avert such potential harm to girls?
Okay. Indeed, the statistics are alarming. Looking at the analysis from the UNFPA report, this is really sad. But what could strengthen the fight may also be the strengthening the legal framework in each particular country. What also we note is that we have countries ratifying international instruments that have beautiful provisions that show the scourge, but domestication is very slow. So strengthening the domestication of international instruments that have good provisions. Sensitizations on the negative effects also is something that would also help with the scourge. And we also have, if the sensitization could also extend to asking people to report cases and even suspicious activities. That is something also that comes in handy so that more people are able to report. Our current Anti-GBV Act, for instance, has a provision that encourages third parties to report. So that is one of the ways that could be used just to avert a potential harm, so that any third party can report suspicious activities within the area. Strengthening of the legal framework on child marriage is also something that would also help with curbing the scourge, because you know, if I have to refer to Zambia, for instance, we do have some good provisions, but we have provisions like what is in our Marriage Act, Section 33, that still says somebody can marry somebody can marry somebody. You can marry someone below the age of 16 for as long as they get you get permission from a judge. So we're saying that that is not a good provision. That is a provision that would encourage child marriage, as opposed to, you know, the check that is there, that, you know, a judge should sit down and make a decision, is not a good check at all. It's something that should not even be there, so that you're just not allowing a child below the age of 16 to get married. And then because of issue of economic factor as well, free education is something that could also come in handy to reduce on the economic stress. Currently, Zambia has the primary school being free, but the secondary school being paid for. Statistics also reveal that there are more children in primary than in secondary school. So some are dropping off for various reasons, including the fact that they are unable to afford the secondary school fees. So free education throughout is something that would also come in handy. Research also reveals that because of the the fact that the schools are so far away from their houses. Some end up stopping so that then they end up getting married. So bringing the schools nearer home is something also that could help with the fight. Improved access to rights and services is also something that would come in very handy, because what research has also told us is that some children are getting married because they have gotten pregnant, so they're being married off because they have gotten pregnant. So if that is the issue, and comprehensive sexuality education being there, can we also have these sexual and reproductive health services, being easily accessible and closer. Comprehensive sexuality education is also being recommended both in school and outside. We feel that this would also these would be good mitigating measures just to avert the potential harm to girls.
Thank you, Maureen. Thank you so much for that response. When you talk about strengthening the local frameworks, I think we do need a strategy, even as advocates for gender equality, on how we will actually hold our governments to account. It doesn't seem to be happening at the regional or continental level, or even at the international level. So I think that is a strategy that we must think collectively, not just as individual countries, but perhaps we should actually consider coming together as African women advocates to come up with a strategy on how we are going to hold our governments to account, particularly on this. Judy, back to you. Now, one of the things that COVID-19 has done, other than keeping us in our homes together, is that it has forced many people and services to go online. And so digital is now the big thing. That space has become the space where everybody is operating. Now, we also know that it has not been a very safe space for women and girls. So what measures should we have in place to be able to optimize the potential benefits of technology so that women and girls can safely access life-saving digital tools and services, but also mitigate the potential risks for women and girls coming online?
Indeed, we're all online, including now. But the first thing, even before we talk about the risks, is to acknowledge the digital divide, the gender digital divide. Again, maybe I'm the, what do you call that? The wet blanket throughout, but needing to reiterate that wherever there's been progress, the progress has always been biased, or you could almost, wherever the progress there is, women have almost always been left behind. And this is the same with the digital space. And so women do not have the same capability and access to online services or online platforms as men. It could be hard to tell from today's platform because, the panel are women and so on and so forth. But if you look and pan out the demographic across Africa, specifically with the different countries, if we're already saying, for example, women are the ones doing unpaid care work, so they're the ones in the home and not necessarily having access to internet facilities. If we're saying women are the ones who are doing the menial tasks, for example, they're the ones providing care for children in other people's homes as well. They're the nannies, they're the housemaids, they're all of these other things. They're not the ones online, they're not the ones on the phone, they're not the ones on the computers. And so even before we talk about the security measures that need to be put in place to protect them within that space, and that is acknowledged, let us first address the digital divide to enable them get here. And back to our original discussion, data is telling us the truth on this. So women's capacity with regards to IT capability, and IT access needs first and foremost to be addressed. And then enter the part two, which is now, how do we provide protection? I think there's specific principles in digital platforms designs and development that acknowledge fundamentally about 5 or 6 different ways through which women, and in fact users of various platforms, can be made safe. Fundamentally is that the different platforms need to be designed or made, and the policy or the regulatory framework for these platforms need to be put in place to respond to the user. And so we acknowledge the sex trafficking online, be it this voyeurism and all of these other things that are happening online, luring young girls, luring women, and so on and so forth. And so the existence of a solid framework and the existence of platforms themselves that acknowledge that these are existing gaps and that begin to address them at the conceptual phase of the designing of these platforms needs to be done. So responding to the user, responding to the women. Similarly, in terms of if the platforms are supposed to respond to the violations that are already existent. For example, we have 1195 in Kenya in terms of calling in the event of violations and so on and so forth. In the designing of these things, you need to realize that how is a woman in the middle of domestic violence able to call you in that context, and therefore beginning to design whatever platforms and systems to be able to respond to specific contexts. We know of, for example, platforms that use smaller bandwidth and therefore they can use specific types of phones. We know of platforms or designs that can convert from analog to digital. So that, for instance, what is sent out as a tweet can wind up as a text to all phones in a particular locality. We know of different ways, innovative ways through which these platforms should be able to respond, again, to the user, but secondly, to the context. And so that it should be able to respond to the context that it's operating. And so let's not make the assumption that, everybody's on Twitter. So I'll tweet this and we will retweet and we'll all have a hashtag and everybody will know they can call this number in case they're being violated and this number to get help. Let's be able to respond and taper and measure the responses to be able to respond to the user, to be able to respond to the context, and to be able to respond to the specific demographic that we're targeting and that we're responding to. In that regard. And whilst we're in the conversation about data, let both the laws and the frameworks and platforms be informed by data. Again, we've been heavy on the qualitative. We can be heavy also on the quantitative. What is the data telling us? What are the kinds of violations that are now prevalent in the context of COVID? And what then can we do in response to that in terms of the platforms that we have? Making them again responsive, but letting the prevalence tell us the typology. It should be able to let us know the different nuances, the more refined bits that can only be told when one analyzes data, and be able to see some of the emerging issues that, for example, when you're undertaking a baseline or when you're on the ground, you're not intending to get this information, but you get it anyway, and are able to tweak your specific responses to be relevant. And so two-pronged, really. One, make sure we're all on the same page. Men and women need to be in the digital age. So women are not, get them on board, and not just in the capability, but also in the accessibility aspect of it. And then secondly, ensuring that we use the data or principles, development of data principles that are in place to ensure that it's responsive to the context, to the data, and to the user. Making sure then we respond to the specific nuances of the issues present.
Thank you so much, Judy. It is important for us to think about everybody because we there's a tendency to operate out of echo chambers. We assume that everybody is operating on the same page, and it's true. Not everybody's on Twitter, not everybody's on Facebook, and majority of the people, I think in Kenya, 25% smartphone penetration, which means that then when you're devising interventions, It can't be only for that demographic. So thank you for that. Meseret, I'm coming back to you. The economies, African economies, actually global economies, have been hit very, very hard by the COVID-19 pandemic. And successful economic recovery is going to require women's active participation. And this brings us back to your statement that we must stop seeing women only as victims, but they can also be active in designing interventions. What policy measures should governments undertake? First, to reduce the crisis impact on women, improve their resilience to health and economic shocks, and ensure that women are integrated into the designing of these responses so that their issues are taken into consideration.
Thank you, Daisy. Now, since we are talking about participation, I mean, of course, it's all about bringing women at the table where decisions are made or where the discourse is happening. So, of course, one of the challenges, in principle, everyone agrees with enhancing women's participation in all political, economic, social sphere. But I mean, tackling the stereotype about women's public participation, women's public life is a very key area for us from what we have seen in the working group. I mean, from all our country visits, thematic report, and also some of the communications we receive. So stereotypes about women's role in the public sphere, women's role in public decision-making has to be tackled first. Of course, this requires a range of interventions from awareness raising to lawmaking and accountability, as well as also supporting women. And creating also the platform itself for women's participation. And the other is also when we think of women, again, the stereotype about women being just a monotonous group. There is not really one group that we call women. Women are diverse. So when we think of involving women, we have really to be mindful of the different groups of women so that we can represent actually the different needs and experiences. So governments need to be aware of this fact when they think of involving women, or when we really want to bring women at the table. I think that's one area that really needs to be part of the intervention. The other is in terms of women's participation is, I mean, of course, it really requires in general to have a meaningful participation or a civic engagement in general. And then in Africa, at times, if I don't say mostly, at least at times, we have seen these repressive measures being really taken even in the context of COVID, in the context of responding to the COVID situation. The state of emergency measures or some of the restrictions have been used also to really silence civic engagement or popular participation. And then we have seen the impact on women human rights defenders or on women politicians or public figures in terms of silencing their voices and shrinking the space where they can really equally participate. So this democracy, I mean, in many places where we have democratic transition or how can I say it, weak democratic institutions, the space has not been really friendly and engaging for women, and of course for the public in general, but again, because of the stereotype I have mentioned earlier, also because of the lack of intersectional approach to bring all women, and the lack of generally the political space or the limited political space, I would say. It has been hard to have women's voices represented or reflected. So tackling stereotypes, intersectional approach, and also shying away from repressive measures and tendencies would really help amplifying women's voices in the context of having their views and needs reflected in COVID and post-COVID response. And coming to, yes, linked to women's participation, but in general also as we design measures to reduce the impact of the crisis on women especially the economic shock or the economic aspect of the COVID impact. I would like to go back to what I mentioned initially at the beginning of my intervention, that it's really clear more than ever now that we need temporary special measures that are really fitting also the COVID context. More than ever, we need to really adjust all interventions, policies, and investments to really reflect the special situation or the special needs of women. And then again, this links to the gender responsive social protection system, which we talked about earlier, in order to reduce or minimize the economic impact of COVID. We need really to design gender responsive social protection measures that are really comprehensive. And we need to make this really gender equality or gender responsive social protection measure the pillar in macroeconomic policies. All macroeconomic policies really need to be anchored on this aspect. All financing, as well as, again, micro or economic projects need to be designed in this manner. And we can think of also as the need for, in the immediate, the need for special services or innovative services that really require what Judy also earlier mentioned about the digital divide. When we think of, in particular, the informal economy, where women are disproportionately overrepresented, we need to be innovative on how to really continue engaging women and create innovative ways of building their livelihoods in this context. So the immediate measures in terms of bringing women in the digital economy as well, while they continue working in the informal sector, would be important. And also the monitoring and accountability aspect is also an immediate need because of the lack of, or the limited services available in the context of COVID, from health to work and also the judiciary. All things go unmonitored, and we need to think of also the accountability and the monitoring aspect in terms of reducing the COVID impact. And on this, I would like to particularly emphasize on budget accountability as well, which is, lacking in many of the discussion. How governments are really responsibly investing on the welfare of women, and how are we really making them accountable? Do we do a budget analysis? How do they invest? How do they allocate? And we often hear that but the budget is a problem for African governments to invest on economic and social rights, but how much they have done in terms of resource mobilization, in terms of using the available resources, all that, the budget accountability aspect, the budget monitoring aspect really needs to come into the picture. And as I conclude, we generally need a new normative thinking on how to really realize women's rights. And the COVID and post-COVID crisis, responding to COVID and post-COVID period will not be limited only with this immediate public health and emergency measures. It has to be a matter of human rights, and all human rights must be addressed, not just the bits and pieces of interventions. A comprehensive human rights-based approach and gender responsive approach is really required. Thank you.
Thank you so much, Ms. Kerem. And you raise several issues, of course, key among them being women's participation in decision-making. And I think, especially for us in Kenya, that's a very touchy one. That's an issue that we're still trying to grapple with. But you are very right when you say that if we are going to address the impact on women and improve their resilience, women will really have to be at the table. And I hope that these are some of the recommendations that can come out very strongly to push countries into ensuring that women's concerns are captured in the post-recovery strategies. Now, I would want us to go into the Q&A. I see there are some questions that the attendees have posed. And I think we will direct the first question to you, Judy, where we have an anonymous attendee who is asking, how do you recommend we get the men and boys to support and fight for women's and girls' rights? We cannot advance on our own if we are to get equity and equality faster. What is your take on that?
I've got several takes, but I'll stick to one. So let me say something that has become a pet, no, what would you call it? Something that I almost always say. The underlying factor that needs to be communicated to all of us really is that gender equality is not a competition, and that rights are not 10 balls in a bucket, that if women get 7, men only have 3 to contend with. And so rights, if we decide it's everybody has their bucket and everybody has their 10 balls, so that if I access mine, you access yours. If I'm alive and you're alive, we're both alive. I don't have to kill you in order to live. And if I kill you, I don't get extra days on my plate. And as rudimentary or basic as that may sound, I think it needs to be clear that women have over the years have had hurdles and holes on their way to their bucket. And all we do, the work we do, is to fill in those trenches and holes to ensure women access their rights. And so once there's clarity in terms of it not being a competition, and I think then everybody would be able to come together to ensure everybody accesses their rights and we live in a better society. And so what my response then is that we need to have values clarification. We need to have an engagement to understand what women's rights are. We need to have an outward-facing strategy, an outward-facing engagement of the society for people not to begin to hear a call for equality and a call for protection for women, especially during this time of COVID, as a competition as against a particular other need, economic or other, but something that is just fundamental to the human existence. And so that is what needs to be done. A conversation needs to be had to completely dilute that discussion that speaks of competition and the immediate response that always comes up, what about the boy child? So that we all come together and address these rights and all of us get to win together. So what can we do? We can have a conversation and just remove the negativity that almost always comes when we talk about equality.
Thank you so much for that, Judy. And I don't think I could have said it better. I've often been telling people that advocacy for women's equality is not about role reversal. It's about shared spaces. And the sooner that we can agree to that, then we will be able to move this conversation forward. I've seen that Maureen, I think I saw Maureen, you've raised your hand, and I think you also wanted to respond to the same or to add something to it. But even as you do, as you add to that conversation, I would also like you to speak to a question here that Jane Raburu asks about psychological violence, and how about psychological violence? So as you address the issue of how we get the men and boys to support the fight for women and girls' rights, also speak to the issue of the psychological violence that is meted out against women. Maureen?
Thank you so much. Yes, just to add my voice to the involvement of the importance of the involvement of boys and men. Usually they are the perpetrators, so it is important that they get to know what their rights are, what the girls' rights are, so that they are not, so that they refrain from violating them. Further, it's important for them to also know the penalty of violating somebody's rights. So I think even in our advocacy, it is important that we do involve men. Psychological abuse is also something that is quite rampant. And even in sensitization, it is important for people to know that that it exists and there are consequences. We've also heard of people committing suicide just because of what they have been told over and over again. So because they've been violated like that over a period of time. So that is an offense. In our Anti-GBV Act, we have an express provision that calls that an abuse, and one can actually get a protection order so that they are protected, so that the other person is constrained from doing saying the hurtful words that they have been saying, or doing whatever it is that they've been saying that's psychologically affecting the survivor. I think that's all that I can say for now.
Thank you so much. As we're scrolling through, Ms. Kerem, there is a specific issue being raised here. If I just go to the top, and it is the Macau Nico says, thanks, Ms. Kerem, for unpacking this issue in a new view. I still keep questioning myself. If you can help now, is it that the African governments and leaders don't see the problem? They don't know, or they ignore it, or they don't know what to do? The affirmative action seems not agreed even by women experts as helpful. It is a recurring issue that cuts across very serious meeting of women and men alike. And before you do respond to that, there is also another question where Mirile Mool says that each year, decade, century, we are talking about women and women's rights. We don't speak about the basics. All the rules have been written by men in our society. How could you explain that since centuries, our improvement is so small? All the international organizations, just a moment, recognize the importance of women, but each time, the only place they promote them is ambassador of peace during weapon conflicts and not a management position. You can hear the frustration in Mirile's questions. Meskerem, perhaps you can respond to that.
Thank you. I mean, interesting interventions, and I mean, it's a shared frustration, I would say, and it's not like I would have one size fits all kind of answer. But coming to the first from Macau, first of all, I would like to say it's not just African governments. It's just because we are now talking about Sub-Saharan Africa, we are more focusing on African governments. But from the global perspective and from what we see, our mandate as UN human rights mechanism or as UN rapporteurs, we have a global mandate, and we get the chance to see the performance of governments around the globe. And from that, actually, I found it very surprising that many governments, even beyond Africa, they really don't see it. Yes, partly it's because they don't see it. And partly they say it and they ignore it for different reasons. So the problem is twofold. And for those who don't see it, I think it's our role to make them see it using the different ways of advocacy, monitoring, and also accountability mechanisms. So that's why sometimes it's very difficult, as basic as it is. Some governments don't really understand all the gendered implications of be it COVID or other contexts. So that tells us we need to do a lot of work in terms of making the issues, the gender perspectives visible in all political, economic, social, cultural contexts. And of course, we have come a long way on that, but still a long way to go for activists and for human rights monitoring institutions. And for those who, they ignore it, of course, because it's because of maybe political, social, and other reasons. And again, account for those who ignore it. I think we have to strengthening accountability mechanisms. As I said from earlier, from the budget, from the budget to also the policy and the institutional framework. We have to have strong accountability mechanisms. We have to really push for that. Anyway, African governments can be those who don't really understand it or who ignore it deliberately. And coming to the affirmative action question, yes, it's the most contentious issue that when we also engage with governments. And it's not just men, even women's rights experts may not agree with it. But in my view, I think we have to really unpack what affirmative action means and what we are asking when we push for affirmative action. Sometimes it's not really explained well, and the people have their own version of what affirmative action should be. And again, as simple as it is, or as basic as it may sound, affirmative action, I mean, it's not, Judy said it very well earlier, it's not about competition, it's not about even denying or taking away some people's rights and giving preference or priority to others. It's a basic human rights question for some to be equal, or for the realization of equal rights. We need to really respond to their specific situation, their specific needs and experiences. It's all about addressing that specific vulnerability, be it or specific need, and all that. So it's the way, sometimes I wonder how it's unpacked in different national contexts, and I see the resistance from many governments, experts, and all that. So maybe we need to do a lot of work in terms of packaging what affirmative action means. Otherwise, it's a human rights obligation anyway. And in the Maputo Protocol, it's explicitly provided that governments have to design affirmative action measures in order to respond to the rights of women and girls. In the CEDAW and other human rights frameworks, temporary special measures, affirmative actions, they are already prescribed as a human rights obligation. So when it comes to the state's obligation, it's not a matter of choice, or it's not a matter of being commuted or not. It's there as part of their human rights obligations. So side by side, while we are packaging the message in a positive way, we need also to bring the obligation or the state duty aspect, and also to demand for accountability, how governments have really put affirmative action as part of their policy and legal framework, and do we even make them accountable for not doing that? That's a question for advocates and for human rights mechanism.
So
yeah,
really, the key really is about accountability. Really, accountability. How do we hold our governments to account for their commitments and the commitments that they sign on to? I think. Can you hear me, Ms. Kerem?
Yes, because I've said that because mostly we don't see any litigation around that for litigators. I mean, not including affirmative action measure is not considered as violating state's duty. for example, to fulfill women's rights. We have not seen really any even communication from Africa and beyond claiming that a state has to really meet that obligation. So it's not really framed as a human rights obligation of the state. And also the message is not really well communicated. Maybe that's where we are lacking, in my view.
Okay.
Yeah, thank you.
Thank you so much. Although you'll be surprised, in Kenya, we are in litigation. In fact, that's one of the litigation actions that we've taken around women's rights. Now, as we wind down, and before I go to the next final questions, I invite the attendees to take the poll. There is a poll on the screen. Please ensure that you take the poll. It will remain up as we move on to the next question. The poll will remain on. And as I direct the next question to Judy, and Catherine asks, how can we collect and record data when access to homes and trust between carers and data collectors is so restricted? And just a moment, and how can we advocate for better M&E, that is monitoring and evaluation in budgets, when it is often A, an afterthought, collected reactively, and B, at best is perhaps 3% of total budgets? That is from Catherine. And there's also a related question by Edwin, which I think I would want you to answer as well. Edwin asks, is there any empirical data out there that one can read for the issues you have raised? Otherwise, superb presentations. Over to you, Judy.
Okay, Catherine has asked excellent questions. So the first one, it's 2 in 1. So she says, how do we get data when, the women are in a vulnerable context, and, the connection between the data collectors and the women is dispersed? So 2 responses to that. One, when we're talking about technology and the use of technology, when you make technology both accessible, friendly, and responsive to the context, then the women are able to communicate the situations. For example, when the number 1195 came up and was popularized in the middle of COVID, in the middle of women being home together with their partners, and there was a rise in intimate partner violence, the recording of the data with regards to the rise in intimate partner violence was because the number was toll-free and it was easy and put in your information in that regard. So providing avenues through which people can send the information easily and in a context that is friendly to recognizing the context, including the ones that you've described, is critical. So technology needs to advance and to be responsive, to be able to enable data to be collected, including from the most vulnerable and including from those who are living in real time. I guess you probably, if would have a right of reply, you'd say, so then what do we do with that data? Because it's important that once it's collected, then interventions are done both in real time to prevent further harm, but also the data collected needs to inform, long-standing protective measures. And we're grappling, shall we say, right now with that, how to ensure that that information results in real-time response. A second way is they're usually whistleblowers who respond to context, including vulnerable contexts. When I spoke earlier of about 75 girls in Samburu being at the heart, I mean, within a week or so are going to be cut. That's female genital mutilation. It's not these girls who in and of themselves informed us of the violation that was going to take place. It would be a neighbor, it would be someone. So we would be able to triangulate the data because of course you have to verify the authenticity of the data. And so you'd find that there are other sources, secondary sources, and other persons within the environs of a violation who would then inform, allowing us to triangulate the data and therefore allowing us to stage an intervention or inform relevant state actors to facilitate an intervention in that regard. In the further alternative would be, unfortunately, the data then is collected after the fact. So baselines undertaken, focus group discussions undertaken, and key informant interviews undertaken, and other methodologies that are used in terms of collecting data are able to collect the data after the fact. In this regard, for example, when we talk about pregnant schoolgirls in Tanzania, you meet these girls, you find that you're able to talk to them. Some of them are visibly pregnant. Some of them have, for example, minutes from school showing how it is they were dismissed, or letters from the school board showing you what has happened. Some indicate the circumstances on which they got violated, which would be rape. And we're able to record such data after the fact. Again, unfortunately, such data doesn't allow us to intervene and preempt the violation, but then such data enables us then to have responsive mechanisms or strategies, such as holding maybe the state to account, or agitating for legal reform, policy reform, and so on and so forth. You had a part B to your question. Let me just quickly read your question and confirm that I'm answering it in totality, Catherine. Right, but right, let me speak to Edwin first as I try to recall your part B, because it was
the part B, part B for
M&E. Yes. So M&E, okay. I think, again, and I'm not happy about COVID, don't take it the wrong way, but COVID presents a silver lining. COVID has shown that the kind of interventions that need to be staged need to be strategic, specific, and in response to specific contexts. And so you can only do that with data. And so organizations that have had data during this period have managed to get resourcing for it. And so you find that the ones that were not staged, or shall we say positioned or postured to be able to collect the data, have been left completely behind and are talking in semantics, or we know data is telling us, but not being able to verify or say this area, this location, and so on and so forth. So yes, admittedly, M&D has been an afterthought, and in a very low percentage. Well, I don't think 3%. If you're playing at 3%, there's a problem. You should be talking about 15%, but it's always been on the back foot and always been an afterthought. But the current circumstances make a case for data. And secondly, I mean, people have moved away from generalized advocacy and are only able to advocate where they have specificity. And so there is a case to be made for M&E, but there's never been a better time to make a case for M&E than now, because you will already see that the institutions, the actors, the civil society actors that have data that they can verify. I saw somebody talking about some erroneous data being put out. I will respond in typing to that one though. There's those that you have data which you can verify have put many actors, many interlocutors in this space ahead, able to not only preemptively respond to violations, but at the same time respond to systemic issues through agitating for legal change and legal reform. And so this might be the case, but you now have an opportunity to advocate, I would say, for more financing in data. And I do not think any development, you'll hear any arguments from development partners at this point, because everybody knows data is king. Then there was a question, I think Edwin it was, who was asking, is there information? There is, from various actors. There's homegrown data. Different institutions, including ourselves, have conducted baseline on some of these violations. At the same time, there's intergovernmental organizations that have done. You've seen the UNFPA data, which speaks to the various violations, specifically in the context of COVID, but also over the long term. For example, they've talked about pregnant girls, child marriage, all of these different GBV violations that exist, not just in the Kenyan context, but regionally, and speak about the variants. The data also provides the legal frameworks in existence. Meskaram is talking about special measures. You find that there's even a raft of recordings or data that shows which states have put in place measures and which have not. Majority haven't, for the record. And so the idea is there is data both from intergovernmental organizations, both from local organizations, but also from, would you believe it, CBOs, community-based organizations, which are more and more being equipped and realizing data collection isn't as sophisticated as it's made to sound. I think that's it, Daisy.
Thank you. I think, yes, thank you. Thank you so much, Judy. As we wind down, I would ask the attendees to please take the poll. If you haven't taken the poll, because the poll will close in about a minute's time. And the final questions, I think we're going into the chat box. And I can see here that there's a comment from Rose. How do we ensure implementation of these policies? What preventive measures can we focus on to address violence against women and girls? Also, Jane says we also need to strengthen girl-to-girl mentorship, especially in the informal areas, identifying the girls with potential, commitment, and interest to work with girls groups. There's also need for community sensitization on existing services with COVID-19. People thought other services were closed and only services related to COVID-19 being available. The fear that when one goes to hospital, they will get infected also affected access to service. Otherwise, going for another meeting in, oh, okay, so she's left us, but she speaks to that issue. I think we can have Maureen. Perhaps you can respond to that as we scroll into the Q&A. Rose is asking, how do we ensure implementation of these policies?
Implementation, okay.
What preventive measures can we focus on to address violence against women and girls? And yes, I mean, I think we need to be critical. How do we ensure implementation of policies? Because we have policies, we have commitments, stated commitments, but they're just not being implemented. So how do we move from talk to action?
True. Thank you so much. Now it's very clear indeed. I'll start with what is happening under the SADC Gender Protocol. Under the SADC Gender Protocol, there's an alliance. So that alliance is monitoring how SADC Gender Protocol is being implemented, domesticated in the various countries. So at country level, every year, we'll ensure that people from the various sectors in NGOs, but various sectors covered by the SADC Gender Protocol come and get to assess how far we have gone with the implementation. A barometer is then written, which is circulated, and so that it's really a name and shame. So naming and shaming helps. Also, sometimes it's sensitizing them. Sometimes they don't even know. There may be some representatives from government who may not even know what they have committed to. Some of the things that we committed to, some international instruments we committed to in 1983, some of them may not even know what is there. So it's also important for us to keep reminding them of what they have provided, what they need to do. It's good for us to keep documenting and keep reminding them this is how it is. Litigation is also one way, especially where it is provided for within the law, but it's just not being implemented. Depending on what your laws are in a particular country, litigation is also one of the ways, so that an order is obtained for the government to do what they have to do. So those are some of the issues that can be done in order to just push for implementation. So sensitization of the government officials and litigation and so on. What preventive measures are there for adolescents against GBV? Is that the second question?
That was more, I think it was more of a comment, really just saying that we have to have mentorship of the young girls and beginning to look for those who would be willing to mentor the young girls, particularly in the informal settlements. So I am surprised at how quickly the time has gone. And I would want to invite each of you. I can see Ms. Kerem. Has Ms. Kerem left us? Yes, she's running to another meeting. So I want to invite the remaining panelists to give us their closing remarks in a minute or less. At the time, we've definitely gone way over time. So let us start with you. Judy, I'll give you the floor in less than a minute, your closing remarks.
Thanks, Daisy. I think I'll just close it by saying two things. One is that, as we can tell, what we are agitating for as women is not new. This is what we've been agitating for since time immemorial. And so I think let's just take the moment, let's seize the moment and use the fact that data is proving our case right to create the urgency around the situation, advocate, and get all hands on deck to get us to get to an equal ground. Secondly, just to say that accountability has very many platforms, and going to court is one. And so we can hold states to account, not just in national courts, but in regional courts. I'm happy to say that late last year, in December specifically, we, for example, took the government of Sierra Leone to court and won the case. And they responded in the positive by lifting a ban against pregnant girls accessing school in Sierra Leone. And so courts are available and provide remedies. Commissions are there. The African Commission is there. The African Committee on the Rights and Welfare of the Child is there. Different accountability platforms are in existence. And so let's hold our governments to account. Thanks, Stacey.
Thank you so much, Judy. And thank you to all attendees and the panelists for such an excellent conversation. I've actually learned a lot. I want to thank the CAS Rule of Law program for their commitment to ensuring that the conversations around women and girls and the discussions around how to address the exclusion of women and girls continue. This conversation will be available on the CAS Rule of Law website for those of you who would want to hear it and to listen in once again, and also on Facebook. So you can log in and find it. So I want to thank all of you. I want to thank CAS Rule of Law, and just to mention some of the key points that have come out in ensuring inclusion of women and girls living in Sub-Saharan Africa in the responses to the COVID pandemic. Accountability. This has been a very strong issue that has been raised by every panelist, that we must hold our governments to account. I like that Judy has talked about accountability's many faces, including litigation. That is just one of them, but we must organize ourselves around the holding our governments to account. Strengthening legal frameworks, and especially in respective countries, this is also very important. Judy talking about the access, addressing the inequality in access by women and girls to technology. This is also another issue, and I think that really needs focus, because technology is obviously the way that we're going. COVID has really pushed us all into the digital space, and so we must bridge that digital divide and ensure that the platforms respond to particular situations. Most of all, I like what Meskerem said. We must have women on the leadership and decision-making table. We need them to be able to bring their perspectives to bear so that we have more gender-responsive policies. There are several issues that have come out, even expanding the scope of what gender-based violence looks like, to also address the specific vulnerabilities, communal violence, other than the actual violence that we see, the economic violence, and the dispossession of women and girls. So there are many scopes. The staggering number of women and girls that are going to be out of school, and the potential risk to them. So we've got many issues that that have been highlighted here, many challenges, but also interventions that can be taken at country level, at regional level, and at continental level. And so I want to thank all of you for participating. Attendees, thank you so much for your vibrant questions, for the chat, for your interactive approach to this conversation. And thank you, CAS Rule of Law Program, Cindy and the team at CAS. Thank you so much, Lawyers Hub, for making this conversation possible. I wish you all a good day, good afternoon, good night from wherever it is that you're joining us, and look forward to having further conversations under the Rule of Law Program. Thank you.